Thank you, dear Professor Terj, for announcement. It's my pleasure to speak about the treatment of upper limb deformity with the external fixation. The aim of the treatment for the treatment of upper limb deformities and lengthening, a modified special external hinge distraction system has been developed which allows combined treatment of congenital and acquired complex deformities of the upper limbs. Materials and methods. Since 1995 to 2010, this new system was used in 120 patients with different indications in the upper limbs. They presented with upper limb length discrepancies and axial deviations and deformities. The hinges were used are the modified system of external fixation device for treatment of fractures, limb lengthening, and correction of axial deviations, SLDF system, Salami Fix number 1. And this is the WIPO certificate award for this fixator. The indications of the external fixation SLDF system, Salami Fix, is limb lengthening, correction of axial and rotational deviations, treatment of fractures, treatment of pseudarthrosis. And the advantages is the multiplanar correction because of used hinges which allow to move in multiple directions. And it's more comfortable to this fixator because of different size arches are used in the system. It makes the suitable shape of the fixator, so the fixator takes the shape of the extremity on which it's applied. And it allows joint movements in all joints freely. Advantages: stable fixation because insertion of wires and pins in the fixator is in different angles and levels, and it's more tolerable because of insertion of wires and pins in a minor painful regions. And it's we could achieve a good correction, and the X-ray control is easy also. Right. This is. It's went back. It's not going. Oh, okay, now. Yeah. This is a case of 26 years old man after infection in childhood and shortness of 11 centimeters and external rotation deformity, valgus deformity of the humerus. You can see here lengthening up to 11 centimeters and correction of axial deviations of the humerus, and it's seen on the X-rays before and during lengthening and consolidation. You can see here the system is modified for humerus lengthening and corrections, and we can see after lengthening 11 centimeters and correction of valgus and external rotation deformity. We see on the X-ray solid consolidation with perfect alignment. And here we can see the comparison after lengthening, 11 centimeters and correction of valgus and external rotation deformity of the humerus. And the photo is comparison before treatment and after treatment. Another case of varus and internal rotation deformity of the elbow after fracture at childhood. This case of cubitus varus of the elbow, you can see severe deformity. And here's a correction of angular deformity of the elbow using the external modified system special for this case. We can see the osteotomy and correction. And can see here the fixator. It's simple fixation and good alignment of the elbow. And you can see functioning during treatment also. It's easy to move the elbow and the upper extremity with the fixator. This is another case with a 24 years old girl with a congenital club hand, absence of radial bone. We can see here I went to first stage of treatment is centralization of the wrist with the using the external fixation system. And at the second stage, I did the lengthening of radial bone and correction of ulnar axis. So you can see here the photo during treatment in the fixator and after removal of the fixator. But the problem not finished because there is a problem in the fingers. The club hand corrected, but the hand is still unfunctional. We can see here on the X-ray, first metatarsal and second metatarsals are close each other, and there's a deformity of the hand, and the hand is unfunctional. What I went here is to do, we see here the comparison before treatment on the X-ray. I applied the fixator of salami fix number 5, which I modified for treatment of metatarsal and fingers deformity, and made separation of between first and second metatarsal bones. We can see here the correction on the X-ray. And see here, polycellization of the hand is a good idea for treatment of this problem using the special external hinge system salami fix number 5. Now here you can see the hand is more functional by gradual separation of metatarsal bones and the rotation of index finger. Another case of deformity of the hand is 21 years old girl, supination contracture deformity after brachial plexus palsy of the hand. We can see here on the X-ray the deformity, supination contracture, and the dislocated radial head. What I did is osteotomy of both bones and correction of the rotation, gradual and closed reduction of radial head, and using combined external internal fixation. We can see here the hand after the rotation of ulna and radial and fusion of the wrist to achieve a functional stable hand. You can see here the treatment before and after the treatment, the supination contracture of the hand was corrected and we achieve a functional hand. Even the face of the patient changed. Congenital syndactyly of fingers is also not easy to correct because it's severe deformity in adults. It's very difficult to separate once a time. So I modified special external hinge system for gradual separation of the finger in order to achieve enough skin for separation. And here we can see here after skin destruction, a simple separation of fingers was carried out. And we can see here the deformity before treatment and after treatment. Special hinges for finger lengthening was modified, salami fix number 5. This fixator I modified for fingers and metatarsals in the hand and foot. We can see here a case after amputation of fingers. So the stump of the fingers I can make lengthening. In this case I could achieve lengthening of the stump of the finger up to 3.5 centimeter. Conclusions. The external fixator is SLDF system, salami fix, is more tolerable to the patient in mobility, size, and shape of the extremity. The system is more suitable and allows free movements of nearby joints because of using different sizes of the arcs with keeping an excellent technical functions. And it's easy to correct all axial and rotational deformities in addition to lengthening using special hinges in the system. Conclusions. The stable fixation because of insertion of wires and hairpins in different angles and the insertion of wires and pins in a minor painful regions, avoiding muscle irritation, makes the tolerance to the fixator is more acceptable, and it's easy for the surgeon to handle and X-ray control. Conclusion: the new developed hinges are easy to use and allows treatment of complex deformity of the upper limbs. And I would like to thank you for your attention.
Thank you very much for a very nice lecture. We shall have discussed